Spent too much time in California. Now I got that Rona. Gotta be a loner. Staring at my phone. Gotta be a loner.
Gotta be a loner.
Hello, this is the thealoneaviruspodcast. It's a joke, like coronavirus, but it's left us all alone. Many of us alone together, but alone nonetheless. And it's weird, right? And I'm your viral host. I'm your Quentin Quarantino. This is Judy. Well, some people on Instagram suggested that I make a podcast because my Instagram has basically just turned into news about the coronavirus and everything to do with that, which has been a left turn from absolute nonsense. So I understand why some people might be annoyed or just plain confused or like, who do you think you are? Well, I agree with you. I completely agree with you. But I guess since my background's in biology and public health, and I'm also an actor, I guess I have some of the skills that might allow one to make an engaging podcast about a very boring but important subject, right? I think there's a lot of podcasts about coronavirus and quarantine and all that stuff out there that have recently popped up, but they're all pretty boring, and this one is going to be just as boring, but I'm younger. No, that's probably not even true. I have longer hair. Maybe not true. I don't know. I don't know what sets me apart. We're all just bored. This is a way to connect with people. It's going to be great. But I do hope that the people that have suggested that I do a podcast did so because there are people that want information. And one thing that I think I am actually good at is distilling science into something digestible, something that people can understand, people that don't necessarily have a background in science. And I think that's an important thing to do, especially during this time. People need to know what's going on and how they need to behave and change how everything affects their lifestyles, their lives, their well-being, and all of that. And this is a weird and tricky time. And I think that we'll get through it, but I also think it's probably still going to get a little worse before it starts to get better. As we compare this country to things that are happening around the world, Italy today had their highest number of deaths, I think, in a day, and they've, from what I can see, that they've been isolated and quarantined for weeks now, and it seems like people are participating and understand the importance. So if that's true, we might be in for some serious stuff in the coming weeks, which is scary. And I don't think there's really been too many reasons or characteristics in the Italian population identified as to why their numbers are so much higher. May have something to do with the amount of people that smoke. Again, this is a viral pneumonia. Any underlying conditions that people have that affect their lungs are going to affect their outcomes if they are to get this disease and be symptomatic. And also, Europeans are closer in contact than Americans are, just culturally. Their greetings are usually kisses on the cheek, stuff like that. So there is a lot more room for transmission just culturally. But it still doesn't fully make sense. Japan, which has a much older population, which we were to believe was the most vulnerable demographic, has much lower numbers. So it's really hard to figure out. And so where we are right now is most of us are quarantined in our homes, and unfortunately, this is the best place for us to be for a number of reasons. I think most of us understand that. There was an interesting article that I saw the other day. My friend sent it to me, and I will read it. It was actually written by a doctor, Princeton alumnus. And, so there's obviously a lot of pushback from people not really understanding why we're taking this extreme approach. But there are also a lot of really smart people that also don't seem to get why this tactic is sensical. And so this was written by a radiologist. I'm a radiologist thinking about how to protect our patients and our families from the serious consequences of COVID-19. I see the fear and panic in society, and the reaction to this disease does not make sense to me. My contention is that we should be protecting those people most susceptible to the disease, morbidities, mortality from this illness. Those who are elderly or immune compromised, those in nursing homes, those carrying Medicare cards, those with known cancer or immune suppressing illnesses. Every interaction with this population should be with caution, with protective barriers. They should avoid going to crowded venues, avoid soccer games, concert halls, and crowded trains during this flu season. The other healthy, younger part of the population should go about their daily lives normally, without masks, but with common sense hygiene and proper etiquette. They should not be quarantined, isolated, or kept from living. Schools should not be closed. Only the susceptible should be kept out of school. Workplaces should not close. Only the susceptible should work from home. Travel should be encouraged for the young. The young and healthy will not die from COVID-19. Instead, they will develop immunity by contracting the virus. They're doing some carpentry work in the attic. Anyway, and when enough young people get the virus, there will be population protection. And when they grow old, they will not die from COVID-19. Instead, with young people inoculated, COVID-19 will become like one of the 115 common cold viruses that we live with yearly, many of which are coronaviruses. I hope I will become immune to this virus before I grow old. What doesn't kill me will make me stronger. Nobody under 30 years old has died in Korea. No one under 50 has died in Japan. Exposure to someone with COVID-19 should not lead to immediate isolation and self-quarantine. If we applied this policy to every aspect of our society, we will not have a functioning society. All of our hospitals and clinics will be closed because all of us in healthcare will be exposed to someone with coronavirus. Plus, containment of a highly contagious disease just doesn't work. If you've ever played the simulation game Plague, you will know that containment never works. Only improved immunity works, either by vaccines or by total population inoculations, like chickenpox parties held in our parents' generations. Inoculate all the kids, get everyone immune to it, and you're done for a generation. Grandparents were never invited to chickenpox parties. Please tell me if you disagree with my assessment and why. I will not say his name. And, this is what I responded to him. I think you're missing the point. You would be right if we had a healthcare system that was ready to handle and treat a potential lot of COVID-19 patients. If we could isolate every vulnerable person until 100% of the pandemic is crested. If we weren't seeing cases of younger folks getting completely ravaged by this disease. Chickenpox or a tolerable discomfort, violent viral pneumonia would be unethical to knowingly expose someone to, even with a 75% chance of being symptom-free. You're suggesting a simple plan for a very complicated disease. You're right that isolation probably won't work on its own, but we need to buy time to develop a treatment or a vaccine or something that will give us some control of the situation. Our approach right now is extreme, but the alternative is ugly and unethical. This is something I've been thinking a lot about. If we were to just isolate just the elderly or the vulnerable, it seems like in theory it could work, but I think it would be impossible to do. And since this disease is so contagious and already gotten out of hand, and we're seeing so many younger folks just getting really sick, and even though they're not dying, it's so unethical to expose someone to a disease that's going to put them in the hospital and make them unable to breathe and put them on a ventilator. That is just the fact that a doctor would. Maybe he didn't know that at the time of writing that, but just the fact that he could suggest that is pretty horrifying, I think. But anyway, there's a lot of information to be given, and I've given so much out. Not that I should be selling it. I'm just saying I've been talking so much about this on my Instagram and social media and stuff, and I don't know if I should just go over everything that's known. I feel like everybody's kind of on the same page, but I'm happy to. I would love to answer any questions. I want to hear people's stories. What is this quarantine situation ruining for you right now? What would you be doing? What are you missing out on? Are you stuck with somebody you don't want to be stuck with? That's hilarious. That'd be great. That'd be really funny. What are you getting? Like, what's the positive here? You know, I want to hear the story of like how you went from, oh, it's just the flu, to, oh shit, this is real and we could die. And this might be the end of the world in the country. Because a lot of us have made that shift. I was at work a couple of Wednesdays ago, and, I was kind of brushing off the whole thing. And then someone sent me an article that was written by an anonymous doctor in Italy that said that they had to choose who to intubate because they didn't have the resources to treat everyone that was coming in with this disease. And one of those people was an otherwise healthy 40-year-old woman. And that just sort of punched me. That information just, what am I trying to say? It punched me in the face. It punched me in the dick. And, and I clocked out of work and I said, I gotta go. And I realized that this is an imminent threat at this point and nobody's taking it seriously. So I left work, packed a bag, got in my car, and drove for 3 days to Pennsylvania because Los Angeles, though I love being there, it did not seem like the right place to be during a crisis like this that is essentially worsened by population density. I wanted to be somewhere where there are fewer people. And so I'm in rural Pennsylvania, and maintaining distance has been pretty easy thus far. And I'm feeling for everybody that's still over in LA and all my pairs of pants that are still there. I hope they're okay. I know LA's on lockdown right now. It's probably real crazy. I'm glad I'm personally not there, but many millions of people are. So hope everybody's okay. And please, I would love, I'm sure no one's going to listen to this, but if they do, I would love for this to be a way to connect with people, because I've been talking to people that I otherwise don't. I mean, we just have extra time. I see a lot of like comedians, like well-known public figures, they're just interacting with people because we're all stuck in the same exact position. We're all affected by this aloneavirus, It's such a stupid name, but it's kind of true. The real virus is that we're stuck alone and we're all infected, right? Anyway, please get in touch with me and let me know what this podcast is, because I don't know. Okay, bye.
Spent too much time in California. Now I'm in Pennsylvania.
So I know I keep saying to get in touch with me, and then I didn't tell you how to get in touch with me. So right now, the best way and the only way to get in touch is on Instagram, thealoneavirus. 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 And find me there.